Thank you so much for coming. We're so happy to have you on behalf of the Institute for Hand Surgery. So I'm going to talk about cubital tunnel syndrome. And it's a tough act to follow carpal tunnel syndrome because everybody knows about carpal tunnel syndrome. Cubital child is definitely the middle child, right between carpal tunnel syndrome and hand arthritis. In fact, a lot of people don't know what it is, and I find that when I have patients referred to me with cubital tunnel syndrome, which really never happens, it's often referred as carpal tunnel syndrome, or it's misdiagnosed, or it's labeled some other condition. So we'll talk a little bit about it. Cubital tunnel is actually the ulnar nerve. So where carpal tunnel is the median nerve, the ulnar nerve is the other very important nerve in our extremity. And it comes, as all upper extremity nerves do, from the brachial plexus. It comes from the roots of C8 to T1. It comes out of the brachial plexus and down into your arm. It travels in the upper arm in the intramuscular septum, so that's between the biceps and the triceps muscle, and then it goes into the elbow, and that's what we often refer to as the cubital tunnel. In this area, and let's see if I can get a pointer. Okay, so there's the cubital tunnel right there. So here's the intramuscular septum. Sometimes the nerve is actually compressed in this area as well. As it goes in this area of the cubital tunnel, there's these two bony landmarks that we see here. Right there, that's the olecranon. Sometimes you may know it as the funny bone. That's actually part of your ulna. And then we have a structure called the medial epicondyle, which is right there. And that's actually part of the humerus, which is in the upper arm. So in between these areas, you can actually, feel each of these structures very easily. And, if you whack this area really hard, you may even get some tingling in your small fingers. Or if you, smack your funny bone, it smarts because this nerve is irritated when you do that. So there's a ligament over here. Sometimes it's called Osborne's fascia. All of those can serve as points of compression of the nerve. Sometimes, rarely, there can be a ganglion in there, but this is actually a very narrow space. It is a true tunnel, and perhaps bone spurs there. Sometimes, when the tunnel is not tight, this nerve subluxes in and out of this area and slides across this medial epicondyle and becomes very irritated as well. So it can often become irritated with a lot of synovitis and inflammation. And it affects the sensory and motor function of this nerve. Another point of compression is right here. It's between the two heads of the flexor carpi ulnaris muscle. So any of those areas can cause damage to the nerve. So what does the nerve actually do? So that's very helpful in understanding. It doesn't do too much in the forearm other than the flexor carpi ulnaris, but as you go distally, you get into the wrist, and it actually supplies most of the motor function of your hand. So there's the interosseous muscles of your hand, the lumbrical muscles of your hand, all of these muscles right here, which are called your hyperthenar muscles. And I will just make a point that about right here, 8 centimeters proximal to the wrist, there's a nerve that comes off. You can see it right there. They kind of drew it. It's a dorsal sensory branch. And it's important because it helps us distinguish whether the nerve is being squished right here or it's being squished right there. So let's say it's being squished right there in cubital tunnel or some type of severe injury, you will have dorsal sensory loss of your hand. Whereas let's say it's being squished here in the wrist, that dorsal sensory function of the nerve is preserved. So that's one useful way of distinguishing ulnar nerve compression here in a structure called Guyon's canal versus the more common area in the cubital tunnel. So this is a little more up-close view of all the structures I was discussing. This is one of the first structures we can release and identify in between these two bony landmarks here. But all of these areas, the flexor carpi ulnaris right there, and right there should be properly released when we're doing a decompression during one of these surgeries. And this is a more detailed view of the actual sensory distribution of the ulnar nerve. You can see it's on the anterior, two small fingers. So this is one of the big ways as primary care doctors, or maybe even in the ER if it comes up, you can really distinguish between a cubital tunnel paresthesia and a carpal tunnel paresthesia. Carpal tunnel patients often complain of numbness right here, whereas the cubital tunnel patients, they'll complain of the small finger going down.